Thank you for joining me. Today we're going to discuss the requirements for bystolic authorizations. There's only one piece of information that's very important for bystolic authorizations, and that is the beta blocker statement. Other pieces of information are just not very frequently asked for or generally are not relevant on the authorization process, such as the hospitalization risk. It's very rarely asked for. However, it can help on an appeal. For the beta blocker statement, you'll want to include what beta blockers have been tried and failed. If you can name those beta blockers, that will be extremely helpful. If you're not quite sure what beta blockers have been tried and failed in the past, it's still helpful, but for many insurers that will not be sufficient, or you may run into problems where it may require an appeal unnecessarily. So what beta blockers have been tried and failed, and if other beta blockers would not be as effective or if they would have adverse effects. Bystolic is a beta blocker that has many unique properties in comparison to the older beta blockers. The clinical relevance of it is not necessarily well known. So if there's a specific reason why the patient either would have a better result or would have fewer adverse effects with Bystolic as compared to other beta blockers, you'll want to include that, or you'll want to include, let's say, like a full workup of the patient if they've got other diseases or comorbidities where the unique properties of Bystolic may be helpful for them. That would be something that is going to benefit you on this authorization process. Other documentation is generally very rarely worth including. It's not that it's not important, and it might on its surface seem like it makes sense to include. However, it's very rarely asked for. And on the few occasions that it is asked for, it's just not, it would be more time effective to not include it. If it takes you 2 minutes to look this up and it's only relevant 1 in 50 times, it's just less time to follow up on that 1 in 50 than it would be to look this information up 50 times to get the benefit of once in a while it being asked for. The hospitalization risk is something that is almost never asked for on an authorization. However, it can be helpful on appeal. The medicine is generally, in the grand scheme of things, not that expensive compared to hospitalization. So if the person has frequent hospitalizations or this drug has beneficial properties that would likely lead to fewer hospitalizations or reduced healthcare utilization in general, again, it won't make a difference on a prior auth. Just the people are clicking buttons. Generally speaking, it's not there's not a process to include that type of thought or finesse in it. However, on an appeal, it may often be ignored anyway. However, for those benefits managers that are trying to save their customers money, they may look it up and decide that it is worth approving despite there being lower cost alternatives that they would like them to try. So in that case, it may be worth including. Other drugs are so infrequently asked for that it's generally not worth including unless it just happens to be right there. Thank you for watching. If you need help with your Bystolic authorizations, feel free to contact us. If it's not covered or if it's too expensive, we'll sort it out and see what we can do for your patients. Hope you found it helpful, and we'll see you around.